Hi, viewers. I am Dr. Rafia Rasu. I'm a professor of pharmacotherapy and interim program director of the Applied Health Outcomes Research Programs. I want to share with you the remarkable features of this certificate program so that you can decide on your career pathways. So what is outcomes research and who uses them? Outcomes research is a broad umbrella term. Well-being of patients and populations. You may have heard the term health services research, health economics and outcomes research, in short, HEOR. They are all under the umbrella of outcomes research. Guides the selection of most effective treatment to improve the health of patients and populations, which often complements clinical trial research conducted in a very controlled setting. So outcomes research provides evidence about benefit and risk of treatments and end results of intervention in patients, individuals, and populations. So what are end results? End results are effect patients and individuals experience. Some of the examples are patients' quality of life, costs, biomarkers like blood pressure control or blood glucose level control, hospitalization, survival, or monitoring, in other words, the death as an absolute event. So outcomes research encompass all of these areas and they helped us to make those decisions. So now, who uses them? Anyone interested in health and well-being of patients and populations, they utilize outcomes research. Government agencies like Health and Human Services, you all know about CDC. They use outcomes research tools to set priorities, to allocate resources to monitor nation's health, regulatory our drugs, vaccine, devices, even they monitor mobile health apps. They utilize outcomes research tools to make informed decisions. Organizations like pharmaceutical companies, clinicians, they utilize outcomes research if they want to know what is happening with their patient population. Even hospitals utilize outcomes research to examine the effectiveness and value of both disease prevention and intervention in real-world scenarios. Global Health Organization, as we just saw, World Health Organization, they utilized pharmacoepidemiology or pharmacovigilance to monitor adverse drug events. They have a separate department where they utilize pharmacovigilance tool to monitor adverse drug events. You may also know many of these policy organizations, the names that you're about to see, as you see here. They utilize outcomes research tools to make informed decisions with real-world evidence. Next slide, please. So as we talked about these outcomes research and who utilize outcomes research, now I'm going to tell you what are the courses that are offered through this certificate program. It starts in August and it is 100% online program that you can take from anywhere. It's a 12-semester credit hour and you can finish it in minimum of 2 semesters. You can complete this AHOR certificate program and here is the layout of 5 courses. In the fall semester, as you see here, you will take economic evaluation and policy course and pharmacoepidemiology course. In spring semesters, you will take economic evaluation and policy, In spring semester, you will take evidence-based healthcare, patient-reported outcome course, and mentor-directed AHOR capstone course. Yes, after you complete all of these 5 courses with 12 semester credit hour, you will get the certificate in Applied Health Outcomes Research. Next slide, please. So in a nutshell, this is how our AHRQ certificate program looks like. Application deadline is in July 31st. We trust this AHOR differentiating skills will make you more competitive in the job market. And you may also use these skills as a stepping stone and make it easier course load for you in our upcoming Applied Outcomes Research Master's degree. This program is for decision makers charged with improving health outcomes for the individuals and populations and for the society as a whole. Next slide, please. So who will teach these courses? Who will be your mentors? I am very proud to say that these veteran outcomes researchers, nationally known and internationally known, reputed faculty will offer these courses and serve as your mentors. They are experienced teachers in health service and outcomes research and excellent in mentoring students. Their mentees are currently now experts and they are employed in academia, pharmaceutical industry, policy organization, clinical research, and managed care organization. So I believe it is a unique opportunity for you to be able to work with these world-renowned experts. Next slide, please. As I'm talking about outcomes research, what are the job prospects of outcomes research? And as you complete this certificate program, where you can work. I want to say that we conducted a market analysis way before we started this program. They identified health outcomes research in the top tier of programs related to all other analyzed markets. There are about 150 companies in the DFW area, and these includes medical centers, hospital system, health systems, health networks, health insurance companies, healthcare corporations, and pharmaceutical companies. These companies may provide job opportunities once students are trained in this AHOR certificate program. Recently, in a LinkedIn job search, we saw that there were more than 5,000 health outcomes research jobs available in the United States. As you see, there's a huge job prospect in this outcomes research area. Next slide, please. So as we talked about these programs, our courses and features, I hope I was able to spark your interest in the Applied Health Outcomes Research Certificate Program. And as you know about these unique features, I trust this information will guide you to take advantage of this unique program as you decide on your career pathway. Thank you.